On the Medicare 2025 referral rule, my name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides and sample policies on Medicare, Medicaid, HIPAA, TRICARE, and state rules and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit the site at www.therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The regulation requires that a physician, nurse practitioner, physician assistant, or a clinical nurse specialist who has knowledge of the case sign the initial certification for the patient's plan of care. The physician or non-physician practitioner must sign the initial plan of care with a dated signature or verbal order within 30 days from the first date of treatment, including the evaluation, or 14 days if it's just a verbal order, in order for the PT, OT, and SLP to be paid for services. Payment for Medicare therapy services may be made for outpatient physical, occupational, and speech therapy services only if a physician or NPP certifies that the services are or were required because the patient needs or needed therapy services. A plan for furnishing such services was established by a physician or the therapist providing such services and is periodically reviewed by the physician, and the services are or were furnished while the individual is or was under the care of a physician. Starting in 2025, Medicare will now allow therapists to treat a patient if they have an order or a referral from a physician, NP, PA, or CNS. A signed and dated order from a physician combined with documentation of such order in the patient's medical record, along with further evidence in the medical record that the therapy plan of treatment was transmitted to the ordering or referring physician or MPP within 30 days is sufficient to demonstrate the physician certification of these required conditions. Therapists will still need recertification of the plan of care after 90 days of treatment. The order or referral must be written, dated, and signed by the ordering or referring physician or MPP and include the type of therapy, physical therapy, occupational therapy, or speech language pathology that the patient requires. The order or referral must also include information to identify the beneficiary and the ordering physician. Some key points. You can still follow the old requirement and have the plan of care signed by the physician or MPP after you start therapy. The order or referral must be written, dated, and signed by the ordering referring physician and include the type of therapy that the patient requires. And you must transmit the plan of care to the referring practitioner within 30 days and have documentation of that transmission, but you don't need to have the signature on that initial plan of care. But you do need a new signature on the plan of care after 90 days from the initial evaluation, like in the old rule. CMS had proposed a 90-day limit that would span from the order of the referral date until the initial treatment of the patient, including the evaluation furnished by the therapist. After consideration of public comments, CMS decided to not implement this rule, but may come back to it in the future. So at this time, you can start treatment at any time after you receive that referral. There's no set limit. The proposed rule would also have allowed a physician to make modifications to the plan of care within 10 business days by contacting the therapist directly after receiving the plan of care from the therapist. Currently, physicians may request changes to the plan of care at any point throughout the episode of care, and the therapist will have to adjust the plan of care based on the physician's recommendations. Furthermore, CMS clarified that whenever a physician amends the therapist's established plan of care at any point during the patient's episode of care, payment determinations for services provided by the therapist prior to the amendment should be based on the plan of care that had been timely submitted to the physician who had written the order or under the plan of care without an order submitted to the physician with knowledge of the case and considering all other applicable payment requirements, including medical necessity. CMS is still considering the rule change and may introduce it again next year. Thank you for watching, and please visit the website for a lot more information on therapy practices, compliance, and billing.